Good afternoon, everyone. Sorry about that technical issue there. Thank you for joining our December Environmental Health webinar. My name is Vanessa Cleven, and I'm the Communications Coordinator at the National Collaborating Center for Environmental Health. Some housekeeping before we begin. As we continue hosting webinars from home, please excuse us if we run into any technical issues. Please make sure to put yourselves on mute throughout the webinar. We may have to remove participants if there's too much noise interruption. If you have a question, please type your questions into the chat box at any time during the webinar, and we will get to them after the presentation in our Q&A session. Today, my colleague Tina Chen will talk about cleaning and disinfection practices in the context of the COVID-19 pandemic. Tina Chen is an environmental health knowledge translation scientist at the NCCEH. She is a certified public health inspector and holds a Master of Public Health from the University of Waterloo, with a focus on environmental health. At the NCCEH, Tina is involved in knowledge synthesis and translation of research evidence on a variety of environmental health issues to support practitioners and policymakers. She also facilitates NCCEH webinars and helps to promote networking among environmental health practitioners across Canada. So I'll pass it on now to Tina.
Thanks so much, Vanessa. Thanks for a lovely introduction. It feels weird to be on this side of the presentation platform, but here we are. So my work in the last few months has been focused around cleaning and disinfection practices during the COVID-19 pandemic, and I'm happy to share my work with you today. So since the beginning of the pandemic, several non-pharmaceutical public health measures have been recommended to reduce transmission of the SARS-CoV-2 virus, one of which is enhanced cleaning and disinfection of environmental surfaces, especially high-touch surfaces. However, just due to concerns and worries about the SARS-CoV-2 virus, some people may have been overzealous in their use of cleaners and disinfectants, both in their homes and in public settings, which may lead to overuse and misuse of disinfectants. And some knowledge gaps in the use of these products may also lead to acute and chronic health risks, which I'll be talking about today. So just before I begin, I just want to let you know about the numerous resources we have developed over the last few months on the various aspects of the SARS-CoV-2 virus and the pandemic, including 2 documents that my presentation today
Everybody is self-monitoring. Okay. Any questions about the?
Sorry, can you please keep yourselves on mute throughout the webinar? Thank you. All right. So 2 documents that my presentation is based off of, and they're all posted on the NCCEH website. I will begin by briefly going over the transmission routes of SARS-CoV-2, followed by an overview of cleaning and disinfection. I will then talk about the existing evidence on the potential acute and chronic health risks associated with exposure to disinfectants and some options to mitigate these risks. Lastly, I will discuss some opportunities for communication and education with others in your communities. So how is SARS-CoV-2 transmitted? I'm sure most of you are well aware of this by now, so I'll just talk about it briefly. So SARS-CoV-2 is a virus responsible for the illness COVID-19. The envelope of the virus is covered in protein spikes, which allows the virus to fuse to host cells and to release the viral RNA into the host cell and infect them. So epidemiological evidence so far has shown that this virus is primarily transmitted via droplets and aerosols. And while fomite transmission is possible, so far the evidence to support this transmission route is still limited. This virus may be shed in the feces of infected individuals as well, but to date, fecal respiratory transmission has yet to be observed. And there's still a lot to be learned about this virus, and research on things such as the infectious dose, research still continues on transmission routes, as well as the persistence and survivability on surfaces and air, and everything is still ongoing. So the primary transmission of SARS-CoV-2 through droplets and aerosols. And the size of droplets and aerosols expelled during respiratory actions varies. Typically, large and medium-sized droplets that are greater than 5 to 10 micrometers are expelled during more forceful actions such as coughing or sneezing. And these droplets fall to the ground relatively quickly and tend to travel about 1 meter or less before falling to the ground. And smaller droplets and aerosols that are less than 5 micrometers in diameter may be expelled during all forms of respiratory actions, including breathing, speaking, singing, and shouting. And their smaller size allows them to travel longer distances and remain suspended in air for longer periods of time. And because of that, smaller air droplets and aerosols may accumulate in poorly ventilated indoor spaces, and close contact and longer duration of time spent within those poorly ventilated indoor spaces may lead to transmission of the virus. So secondary transmission, Fomite is considered to be a secondary transmission of the virus. The role that it plays in transmission of SARS-CoV-2 is still being studied, but so far the evidence shows that it plays a very minimal role in transmission of the virus. And droplets expelled by infected individuals may also settle on surfaces with which others may come into contact. And infected individuals may also contaminate surfaces with contaminated hands. And subsequent contact by others with those contaminated surfaces, followed by touching of the nose, eyes, or mouth, may lead to infection. However, to date, the evidence to support this transmission route is still limited. This is possibly because the risk of transmission from fomites depends on factors such as how many viruses are actually present on the surface, how long the viruses remain viable on the surface, and how much of the initial viral concentration is transferred onto the hands, and then subsequently the eyes, nose, or mouth. And so the diagram on the right are just some examples of high touch surfaces that are typically touched more frequently by more people throughout the day. These include doorknobs, faucets, phones, countertops, door handles, shopping cart handles, and credit card terminals. All right, so with that, we'll now talk a little bit about cleaning and disinfecting environmental surfaces. So I briefly showed a diagram earlier of high touch surfaces. In general, surfaces in various settings in a community can be categorized into food contact surfaces and environmental surfaces. So for the purpose of this presentation, where I won't be covering food contact surfaces just because they require a different level of sanitizing and they must be food safe. So far, there's currently no evidence to demonstrate that viral transmission can occur through consuming contaminated food. And for environmental surfaces, they can be further divided into high touch surfaces, which are frequently touched by many people in a given time period, and low touch surfaces, which are only touched by select few people infrequently. And generally, high touch surfaces should be disinfected more frequently than low touch surfaces. So what are cleaners and disinfectants? So generally, cleaners are defined as detergents or abrasive cleaners that are able to physically remove dirt, debris, dust, bodily fluids, and other organic materials from a surface. Some cleaners cleaners may also be able to inactivate certain microorganisms, such as envelope viruses. Because, so for example, SARS-CoV-2 is the envelope is actually made of fatty acid type envelope, which may be inactivated by certain types of soaps and detergents. But these cleaners are not able to fully eliminate them. And because presence of organic materials may reduce the effectiveness of disinfectants, pre-cleaning surfaces prior to disinfecting is an important step unless you're using a dual cleaning / disinfecting product. And surface disinfectants for hard, non-porous surfaces are able to kill or inactivate different types of microorganisms. And different products require different concentrations and contact times to kill the target microorganisms. This is why it's important to follow all the labeled instructions on different products. And these disinfectants are typically subcategorized into low, medium, and high level disinfectants from an infection control perspective. So what I mean by that are the ability to which these disinfectants are able to kill different types of viruses. So for example, low-level disinfectants are only able to kill some types of bacteria, some fungi, and some viruses, but not spores or other harder to kill microorganisms. Whereas intermediate-level disinfectants may be able to kill a greater range of microorganisms and as well as viruses, but again, not spores. So again, these are more for the medical devices and for in hospital settings. And high-level disinfectants, of course, are able to kill a much wider range of microorganisms, as well as viruses, but not necessarily bacterial spores, unless they're designed for such purpose. So typically for SARS-CoV-2, an intermediate to intermediate high level of disinfectant is required. So in Canada, cleaning and disinfecting products are regulated to ensure efficacy and safety for users. Cleaning products are regulated under the Canadian Consumer Product Safety Act, and they are required to provide instructions on usage and safety in both languages. And for surface disinfectants, they are regulated as drug products under the Food and Drugs Act. The manufacturer is required to demonstrate that the disinfectant is effective against the microorganisms they claim to kill, as well as usage and safety labels to prevent acute health hazards. All the approved disinfectant products are given a drug identification number, which signifies that the product is approved for marketing and sale in Canada. And while manufacturers are recommended to consult and provide information on acute health risks, a comprehensive evaluation of the potential chronic health risks from long-term use of the product is not required. So for use against SARS-CoV-2, Health Canada regularly maintains two lists on their website. The hard surface disinfectants and hand sanitizers list, and the disinfectants and hand sanitizers accepted under interim measures list. So the products on the interim measures list may not be fully compliant with labeling requirements in Canada, but are authorized for sale in another jurisdiction, such as the US, with similar regulations and quality assurances as Canada. So manufacturers are encouraged to apply for approval and registration on both of these lists so that consumers may have confidence in the product's efficacy against SARS-CoV-2. I'm sure many of you have seen this website already, but it's just important to make sure that the products that people are using are approved for such use if they're intending to use it against SARS-CoV-2. So, there are many ingredients in different disinfectant products, and there are also several classes of active ingredients. And these classes may be grouped into three main classes of active ingredients, which are bleach or sodium hypochlorite, peroxides, and quaternary ammonia. And each of these active ingredients react differently with other cleaning and disinfectant products and may produce harmful byproducts that may cause acute physical reactions. Okay, so my intent in this presentation is not to provide you with detailed cleaning and disinfection practices, as these practices may vary between jurisdictions and provinces. So in general, as I mentioned, use an approved disinfectant listed on the Health Canada website. And in general, high touch surfaces may be cleaned and disinfected twice a day, while low touch surfaces may be cleaned and disinfected once every few days. And several factors should be considered when developing and implementing routine cleaning and disinfection policies with the goal to avoid overuse and misuse of disinfectants while ensuring that the risk of fomite transmission is reduced. So at this point, I just want to emphasize again that surface cleaning and disinfection is only part of a wide range of public health measures that are designed to reduce the risk of transmission in a community and private setting. Some businesses may have emphasized enhanced cleaning and disinfection practices as the main control measure against SARS-CoV-2 and may have disregarded other or downplayed other measures such as adequate distancing and ventilation within the indoor spaces. As well, some private citizens may have increased disinfection in their homes, but may have neglected other control measures. And also knowledge gaps in the use of these products may lead to overuse and misuse of disinfectants, which may increase the risk of acute and chronic adverse health impacts. Again, as I mentioned previously, SARS-CoV-2 is primarily transmitted via droplets and aerosols during prolonged close contact or extended duration of time in a poorly ventilated indoor space. Therefore, while surfaces may potentially become contaminated with SARS-CoV-2, there is currently limited epidemiological evidence to support fomite transmission. That said, there's still a lot to learn about this virus, and this is why it's important for us to continuously keep up with new evidence and information in order to update our messaging. Research studies on the persistence of SARS-CoV-2 on surfaces have only been conducted so far in experimental settings and have been criticized for their real-world applicability, as well as the variance in their study design and experimental conditions. So now we'll talk a little bit about some of the research findings from the rapid review that was conducted about the potential acute and chronic health risks associated with exposure to disinfectants. So when I say misuse, I'm referring to the improper mixing of disinfectant solutions that may lead to chemical reactions, which produces harmful byproducts that may cause acute reactions in users. And sometimes some disinfectant solutions, such as bleach, requires dilution with water, and improper preparation, such as using hot water or making a highly concentrated bleach solution, may subject users to harmful gases from the solution. And overuse of disinfectants refers to the excessive use of disinfectants over the recommended frequency, which may not only result in acute adverse reactions, but also potentially chronic health impacts, which we'll discuss a little later. So researchers who were examining potential chronic health risks associated with exposure to disinfectants have identified some confounding factors in their research that present challenges in their studies. And a lot of these studies looking at exposure to disinfectants and cleaning products and potentially resultant health outcomes, typically retrospective studies, which use surveys to kind of look at what the exposures were and what the outcomes are. And some of these factors may be difficult to eliminate or control. And these include ingredients in cleaning and disinfectant products that are not the active ingredient being studied, but may also act as allergens and sensitizers. And additionally, there are many indoor contaminants such as volatile organic compounds from furniture, carpets, and paints, as well as tobacco smoke and mold and dust and other allergens that may also trigger asthma and other respiratory reactions. So in terms of occupational exposures, workers such as custodial staff generally experience greater exposure to cleaning and disinfecting products. Past studies have shown that increased exposure to cleaning and disinfectant products is associated with an increase in the risk of asthma, new onset asthma, as well as other adverse respiratory health impacts. Specifically, increased exposure to bleach and quaternary ammonium products is associated with adverse respiratory health impacts. And it also seems that this association follows a dose-response relationship in that the more you're exposed to, the greater your risk of health outcomes, adverse health outcomes. And these adverse health outcomes include asthma symptoms and new onset asthma. And in terms of non-occupational exposures, including domestic exposures, the evidence appears to show that there's a dose-response relationship as well in non-occupational exposures. However, so research evidence in this area outside the occupational context is quite limited. And it appears that low use of disinfectants is able to reduce asthma and allergies indoors, potentially due to the reduction of common indoor and outdoor allergens. And using disinfectants more frequently appears to be associated with increased risk of asthma in young adults. So in terms of indoor exposures in children, children's exposures to cleaning and disinfectant products were also examined. In general, children who were exposed to bleach at home and in school experience an increased frequency of respiratory symptoms and related infections. And higher disinfectant use was also associated with higher frequency of adverse skin and respiratory impacts. However, similar to in young adults, disinfecting once a week appears to have a protective effect against asthma risk, possibly due to reduction in indoor allergens. And a study of several early childhood education centers that use bleach regularly to disinfect surfaces found an unacceptable concentration of chloroform in the air, which is actually a byproduct of bleach and organic materials. So, so I just wanted to mention, so the chronic health impacts from disinfectant exposure, it's challenging to reach conclusions from limited evidence, as many of these studies, as I mentioned, are retrospective studies that rely on surveys that ask about past exposures and the current symptoms, and they may be prone to recall bias. And some of these studies also do not distinguish between cleaners and disinfectants, or even different types of disinfectants. For example, bleach or quaternary ammonium or peroxides. And sometimes these products are simply grouped together as household chemicals, which further complicates our understanding of these potential health impacts. So nevertheless, during the COVID-19 pandemic, with increased disinfection practices, it may be prudent to choose products that may be less hazardous and ensure that products are used appropriately to avoid misuse and overuse, especially for more sensitive and vulnerable populations such as young children, as well as workers who are frequently subjected to cleaning and disinfectant products. So I also want to mention that the method of application of disinfectants also influences the risk of adverse health impacts. So there are various methods of applying disinfectants, as you can see in these pictures on the slide. So the most common one in household settings is obviously the trigger sprayers or the manual application. And in some businesses and larger institutions, they've also taken up, or they've also looked into technologies such as electrostatic sprayers or fogging machines. So some studies have shown an association between using trigger sprayers to apply household cleaning products and respiratory health risks. This may be due to the proximity of users to the trigger sprayer and lack of personal protective equipment during application. As well, the aerosols generated by different types of spray applicators may remain airborne for an extended period of time, depending on their size and physical characteristics of the indoor space. For example, electrostatic sprayers may produce droplets ranging from 40 to 60 micrometers, while fogging systems may produce droplets as small as 1 to 10 micrometers, depending on the process used. The small size of aerosols from fogging machines may cause issues for occupants if the room is not sufficiently aired out after application, given that the aerosols may remain in the air for longer periods of time. And in the past, there was a case where a fogging machine was used to apply disinfectants in an ambulance, and subsequently paramedics who used the ambulance after the application complained of headaches, nausea, and other physical reactions as a result of the aerosols that were still in the air within the ambulance itself. So with that, let's talk a little bit about some options to reduce potential acute and chronic health impacts. So as I mentioned, when you're developing a routine disinfection policy for a specific setting, there are a few things to keep in mind. The local context of and prevalence of the disease in your jurisdiction, as well as the physical characteristics of the specific settings that you're reviewing, and the population that frequents that setting. And these considerations are not just only important for developing disinfection practices, but they're also applicable for other control measures within those settings. For example, physical distancing, occupancy level, types of ventilation and air exchanges that might be required, and other types of control measures that could be implemented in these settings. So the literature has provided several suggestions to reduce accidental and overexposure to disinfectants and to prevent potential health risks. And these include substituting trigger sprayers with manual applicators, with manual application of disinfectants, substituting certain disinfectants such as sodium hypochlorite and quaternary ammonium products with other alternatives that have lower health risks, which ensures that users, and ensuring that users wear appropriate personal protective equipment during application, increasing ventilation in the treatment space, providing proper worker training and safe disinfection practices, and avoiding using these products around children to reduce their exposure. Also, allowing the treated area to air out following application would also help to reduce exposure to occupants. And importantly, always remember to follow manufacturer's usage instructions and avoid mixing products. If possible, use pre-mixed products as much as possible. So there are several opportunities that may be possible in your area or your jurisdictions within your work for frontline environmental health practitioners to promote awareness of the acute and chronic health risks, which I will discuss in the next few slides. So the importance of, I think, educating the public about appropriate use of disinfectants is because some data has shown that there are knowledge gaps in the safe preparation and use of cleaning disinfectant products. And data from the US and Canadian Poison Information Centers have also reported a rise in calls related to accidental exposures from the use of cleaning and disinfection products. And The US Poison Center also reported a rise in calls related to exposures in children, although this trend was not observed in Canada. So this, I think, really highlights the role that frontline practitioners have in communicating these risks and educating the public about how to mitigate them. So during the COVID-19 pandemic, this is not only for communicating disinfectants, but really about any public health messaging. So messages should really be kept as simple and clear as possible, and obviously using language that the public can understand. And the most important information should be prioritized in the message, perhaps at the beginning of the message as opposed to at the end of the message. And also long lists of recommendations may not maintain the reader's interest. And it's important to identify your target audience and tailor your messages to the group. And messages should be designed with the final intended outcomes in mind. So this means, for instance, messages to prevent accidental misuse or overuse of disinfectants should be combined with specific instructions on how to do so. Last but not least, messages should be inclusive of all identified affected populations and communities in the target group or site or setting. So these are just some opportunities or examples of working with operators in your communities by providing clear guidance on cleaning and disinfection practices of high touch surfaces and instructions to avoid accidental misuse or overuse of cleaning and disinfectant products. And it should also be suggested to them to ask their staff to wear appropriate PPE while cleaning and disinfecting the premises. And if operators are interested in learning about about disinfectant alternatives that are possibly safer and less hazardous and actually even more environmentally friendly, there are third-party certifiers who have identified products that are less hazardous and more environmentally friendly. And these certifiers include Eco-Logo, Green Seal, and the US EPA Design for the Environment program. And you may also be able to work with retailers in your communities to provide informational pamphlets to help consumers use cleaning and disinfectant products safely and appropriately, as well as provide additional resources within these pamphlets for disinfectant alternatives that are less hazardous to health. Again, letting them know about third-party certifiers such as Eco-Logo, Green Seal, and the US EPA Design for the Environment program. And there may be opportunities to work with other public health teams in your public health units, may be able to collaborate to develop resources for various facilities or target groups on safe disinfection practices, as well as other public health measures. And last but not least, there may also be community organizations in your jurisdictions who may be looking for guidance on safe disinfection practices. And they may be interested in learning also about disinfectant alternatives certified by the third-party certifiers I mentioned previously. And it may also be useful to include the importance of balancing the use of disinfectants with other public health control measures, including physical distancing, face coverings, increased ventilation, and reallocation of indoor spaces. So we do welcome other suggestions of opportunities for collaboration, communication, education with other key stakeholders in your jurisdictions. Those are just some examples that we came up with. But again, we would welcome any other suggestions for discussion with others in the group today. So in summary, Surface cleaning and disinfection remains an important control measure to guard against transmission of SARS-CoV-2 when used in conjunction with other control measures. However, the appropriate use of cleaning and disinfectant products should be clearly communicated to the public to prevent accidental overuse and misuse and potential health risks. There is still much to be learned about the SARS-CoV-2 virus, and there's still lots of knowledge gaps in what we know about the virus, including we don't know the infectious dose of the virus. We don't know how it interacts to and from fomites and how it transfers from fomites, either from the infected person to the fomite or from the contaminated fomite to another person, as well as the transfer rate from a contaminated hand to the mucous membranes in the mouth, nose, or eyes. We also don't know about the survivability and persistence in the air and on surfaces in real world scenarios. And research is still ongoing about how it might resuspend or re-aerosolize from various types of surfaces and much more. And new evidence may emerge next week that may change our public health messaging. So again, that's why it's important for us to keep up with emerging evidence and information. So I hope this presentation was helpful, and I would welcome any questions or comments for discussion from the audience. Thank you.